Now, addiction, you start thinking, okay, so what does that really mean? It means that the use of the chemical has changed the capacity of the individual to look after themselves. They just cannot live by themselves, whatever their circumstances. They need that chemical. And they will do whatever is necessary to keep getting that chemical so that they can have an effect of the chemical, which itself is going to deteriorate over time. It's never going to be as good as the first time. But the process of using chemical changes their life to the extent that they have morbidities and many will die. So what do? We need to have some way to look at it, to evaluate it, and to take care of the situation. To consider what happens to the individual, we have to see that a majority of the problems are either physical or mental. A wide variety of disorders are related to chemical use. Most commonly in the gastrointestinal system for those who are ingesting the chemical, in the respiratory system for those who are inhaling it, and through the entire body for those who are injecting it. So there is a whole plethora of diagnoses which can be discussed, but this would not be the right place for it. Suffice it to say that many times people need to be hospitalized. A study early as 1985 in the UK showed that 25% of the people who came to the emergency room of a hospital had a definitive history of the use of drugs and the effect of drug in the immediate period preceding their arriving at the emergency. So you can understand use of the chemical related to a situation which requires medical help. Now, not everybody is conversant with understanding addiction as apart from the medical morbidities. Most physicians are quite okay with treating medical morbidities. But to understand the nature of addiction, how it impacts the individual, what should be the type of resources and therapy available, this requires additional study and experience over a period of time so that an appropriate therapeutic protocol can be developed for treating addiction. And treating addiction does not mean a one-time shot. You treat and there's no further addiction. On the contrary, the potential for addiction lies within the individual, and as long as the potential is stimulated and the circumstances are right, an individual is likely to go back into addiction. So it's a lifelong process, and this is not easy for anyone, neither for the patient or the person who is suffering, nor for the therapist or the system which is trying to support it. Big complex, big issue, big facilitation, and big finances are involved. So psychiatric morbidities, everybody says that, okay, you can just take a pill and reduce your stress or something like that, but it doesn't happen just like that. It requires an extensive process of self-evaluation. It requires counseling. It requires helping the individual to gain capability of dealing with circumstances which are probably going to be on an everyday basis. So it's complex, it's not simple, it's a field in itself. And many people, both professional, paraprofessional, and non-professional, are now working extensively in it.